Hello. So I tried this just a minute ago, and on the YouTube webcam thing, and it didn't didn't work out. So I'm gonna try it again. Uh, this is an update on Laser Spine Institute. A lot of people have been very patient with me and asking me about the update, and what's going on. It's been about 4 months since my two laser spine surgeries. Quite honest with you, I've been waiting. There's a method to it. I just haven't been trying to hold out on you, but I've been waiting for a couple of things. Number one, I wanted to make sure that what I'm going through was not quote unquote surgery type pain, pain from the surgery. It's been over 4 months now since my surgery. My two surgeries in Tampa. If this video is not going to make any sense to you, if you don't go back and watch my laser spine videos, go to my channel, find all the laser spine surgery videos, and watch at least a couple of them. It'll get you up to speed. But I'm about 4 months out of two laser spine surgeries on C5 and 6, I think it was, and L5S1 sections of my back that they had some bulging discs, and they made an incision and minimally invasive surgery and so forth. Anyway, here's the update. And then here's the other reason I haven't really updated it, because the news is not all that great. The improvement that I feel, I think there is a small amount of improvement, but I would say it's marginal at best. The one they done in the neck, it seems like there's a little bit of improvement. When I lay down and turn my head and so forth, I can feel a little bit of improvement, but it's not by any means better. I wouldn't say. I turned my head more than 45 degrees. Actually, that's not that bad this morning. That's actually feels kind of good, or it doesn't bother me as much. The pain shooting down my arms, I don't really remember how severe it was, but I don't really feel that anymore. Pain in my legs, which they call that sciatica, still feel that on the front of my legs. Here's the thing. I have a condition called DDD, degenerative disc disease. Basically, what that means is that's arthritis. How I got it, I don't know exactly. I'm sure that my lifestyle in the construction business for 15 years of roofing and framing houses and so forth, I'm sure that took a very serious negative effect on it. Excuse me. My situation was not a what they would call a trauma situation, like a wreck or a fall or something like that, some single event that happened. Would I recommend Laser Spine Institute? Well, let me tell you it this way. Laser spine surgery will not fix arthritis or degenerative disc disease. It will not happen. To my knowledge, there is no medical cure for that condition. Nobody's got one. It has never been fixed by medicine that I am aware of. Some people have it worse than others. Some people have had relief from it, and some people are living a reasonably normal life with it. However, it's never been cured that I know of from a surgery or from therapy or from any kind of chiropractic that I know of. I know that the people that claim they can fix, I've seen it all. They're all, in 2 years now, believe me, I've been to thousands of websites and I've listened to thousands of doctors, chiropractors, holistic healing type of people that make claims that 90-some% success rate with their particular program. Okay, that's all fine. Okay, that has not been my experience. Okay, back to Laser Spine Institute and the update. Would I recommend them? Yes, with this precaution. This is my unprofessional opinion. Keep in mind, I'm not paid by them. I'm not paid to make them look good. I'm not paid by anybody else to make them look bad. Okay. If you've had a wreck or a trauma type of situation, fall off a ladder or something that's injured your back, so to speak, I'm pretty sure they could probably fix you up. If you have DDD, I'm not sure that they can. I recommend them, yes, based on this. I think they're probably the best gig in town. Meaning that what they do is essentially the actual procedure that they do is probably the same procedure, let me try to put this. You're going to have to be patient with me because I don't know the medical terminology for what I'm trying to say. I think the result of what they do is probably pretty similar to the result of conventional surgery. I think their method is different, and I think their method is better. They're basically doing it arthroscopically or, minimally invasive, but ultimately their accomplishment is ultimately the same thing. You have bulging discs and you have bone that's encroaching on your discs and nerves in your back. And they're basically going to stick a machine in there and try to cut some of that disc away, cut some of that bone away, and basically make room is basically what they're doing. I think that that's pretty much the same thing that the conventional surgery people are going to do, but they're going to do it differently. They're going to cut your muscles. The conventional surgery, they're going to cut your muscles. They're going to remove some of the muscles, and the healing time is a lot longer from what I understand. Never had it. With the laser spine surgery, I think they have a better way of going about it, but they're ultimately going to do pretty much the same thing. This is my opinion. If a conventional surgery would fix your situation, then I think that a laser spine surgery would fix your situation easier and better. That's my opinion based on 2 years of study of a personal experience. Let me give this disclaimer. I'm not by any means a professional doctor. Okay. In some ways that's better, and let me explain to you why. Every individual I've talked to, the people that do laser spine surgery, guess what? They say that they're the best game in town. The people that do conventional surgery, you know what they say? They say laser spine surgery sucks. The therapy people that sell therapy, they say therapy is the best way to go. The people that give those cortisone shots, which I did not have because of the research I done, I could find nobody that really, the only people that really promote those epidural shots are the people that charge about $5,000 to do one. Okay. That's the reason why I didn't do it. I could find nobody in the field that has had success with that. The only people that really, you talk to the doctors behind closed doors and ask them if they really think it's going to work, they'll tell you no. The only people that really toot the horn for that thing is the people that are getting $5,000 to stick a needle in your back. and that's just a fact. What I'm saying is, I feel that there's a lot of prejudice and biasness in the medical field. So when you look at people on the internet that are either tooting the horn for laser spine surgery, or they're dead set against it, most of the time there's a money trail behind it somewhere. I saw this thing the other day on the internet. This dude in northern Indiana, he's claiming that his chiropractic method for DDD is 90.2% successful. Don't know anything about it. Can't confirm or deny that, but I'm going to tell you this. It doesn't shock me that he would say that, considering that's his job. I'm saying it's possible that he is biased in saying that. And I'm kind of rambling here because I have a lot to say, but I don't really want to bore you. You guys are probably like me. You're really frustrated. If you're like me, you're thousands and thousands of dollars in debt. And your situation is not much better than it was, in my case, 2 years ago. I've spent out of my pocket $18,000. If you count what I've spent versus what I owe, it's maybe closer to $20,000 out of my pocket. And my situation is not really any better than what it was. And I just think, I could have bought a new Harley for 20 grand, and believe me, my situation would have improved with that. But anyway, that's neither here nor there. And it's frustrating. Right now, I'm in therapy. I don't remember if I said this on the other video that failed, or if I've said it, that I'm going to therapy now at a rehabilitation therapy facility. Of course, what they told me is they wish people would come to therapy before they go to surgery, and see if maybe they can improve your situation with therapy. But no, right now, my summary of laser spine, my situation is it's not entirely better. I had hoped for more. I had hoped within 4 months I would not be on pain medication, that I would be working full-time in some sort of reasonable capacity with a pain level way down to 20% or something of what it used to be. I was hoping for a 75-80% improvement. I have not experienced that. Maybe a 10% improvement at best. And there's a lot more I want to say about this, because I'm not dogging on Laser Spine Institute. There's several things about them that I like. I do like the way they do things. I do like that they told me the truth about the billing, and I think I want to talk to you more about that. But I'm going to end this video for now, and I'll probably follow up again soon. And have a blessed Sunday. I'm getting ready to go to church here in a little bit. I'll upload this. Hopefully, I'll upload this video before I go, and I'll talk to you guys more about this later. Have a blessed day. Goodbye.